There's been a lot of talk with respect to the COVID positive test and things like that. And I think it's important to point out, since we did our seniors first vaccination effort at the end of last year, beginning of this year, we've seen between a 70 and 75% reduction in mortality year over year compared to last summer's wave, as well as in the January peak. We've also seen almost 25,000 fully vaccinated people test positive. I think we had assumed that it would provide more sterilizing immunity. And so the positive tests, and people are like, well, why is this happening? I was vaccinated, it shouldn't happen. And all I can tell you is what the data we see and the hospitals we talk to all point that this is helping reduce dramatically mortality, particularly among our most vulnerable residents. You can still test positive. I think we're seeing that. But at the end of the day, really turning this in from something that was much more threatening to, say, a senior citizen to something that is more manageable. I mean, that's a huge, huge thing. I mean, we have a 90% reduction plus in mortality in long-term care facilities since we went into those at the end of last year, beginning of this year. So yes, there are positive tests among vaccinated. At the same time, the mortality and all the data is very, very clear. And so we think doing the seniors first was the right thing to do. And we think the fact that even amidst a lot of positive tests, you still see much less mortality than we did year over year. That's important. So it may not mean you'll ever test positive, but I do think the severity has been lessened, and I think these hospitals would all say the same thing in terms of what they're seeing. In fact, they're seeing a much lower median age, and I think it's because so many of the elderly, we basically protected the vulnerable very quickly. 91% of seniors, according to CDC in Florida, have gotten at least one shot. If you look 50 and up, over 75% vaccinated, and then many have recovered from COVID. So you're looking at well over 80+% that have some form of protection. Also worth pointing out, a place like Miami-Dade, Jackson hospital system, one of the largest in the country, their COVID positive patients are about half of what they were during last summer's wave right now, the census. Now we have other parts of Florida where it's exceeding what they had last summer, but I do think the fact that Miami went through a wave, I think you have a lot of population immunity. I do think you have good vaccination. That is just the reality that we're seeing here, and so I think that's a positive sign. So going forward, we're really looking at to me, the best indicator, I know the media fixates on cases, but the best indicator is the emergency room visits for COVID-like illness. And when you see that go up, you're going to see increase in prevalence and an increase in hospital admissions. When that levels off or goes down, all the other indicators follow that. And so we follow that very closely. It went up very sharply throughout most of July. Towards the end of last month, it started to stabilize. We've basically been plateau. So we're looking to see that roll over. And when that rolls over, I think you're going to see some of the other indicators roll over as well. But at the end of the day, having protected the vulnerable, having protected seniors, we do have the data that's saying this is reducing the potential severity of that. And so these things come. We have summer season for whatever reason in the Sun Belt and particularly Florida. We'll nose over and go. It will probably come back in the winter just like last year, not as much as the Northeast, but we'll see. But at the end of the day, I think ultimately the numbers speak for themselves in terms of the severity and the fact that we're down so much, both in nursing home and in the broader senior population. And so that's a really, really good thing. Happy to take a few questions.
Governor, Florida is being considered the epicenter of the pandemic because not just of the number of cases, but also the number of hospitalizations, with Florida making up about, with 50,000 hospitalizations in the country and more than 10,000 are from Are you possibly reconsidering following some of the CDC guidelines?
Such as?
Or what are you hoping to do in regards to the increase in hospitalizations in the state of Florida?
Well, like I mentioned, we are watching the CLI. That is plateauing. The hospital admissions have slowed. I don't think we've reached the peak yet, but I think we're going to settle in hopefully this week or next week. But in terms of shutting down, we're not shutting down. We're going to have schools open. We're protecting every Floridian's job in this state. We're protecting people's small businesses. These interventions have failed time and time again throughout this pandemic, not just in the United States, but abroad. They have not stopped the spread, and particularly with Delta, which is even more transmissible. If it didn't stop it before, it definitely ain't going to stop it now. And so I think it's very important that we understand that. The best defenses we have are the combination of the natural immunity that's been built up and our seniors first vaccination efforts. I think that's why you have such a steep decline in mortality year over year. And look, at the end of the day, would I rather have 5,000 cases amongst 20-year-olds or 500 cases amongst seniors? I would rather have the younger because of the effect that it has. And so I think protecting the vulnerable has been the right way to go. And, I do anticipate us monitoring those indicators. But I think it's important to point out because obviously media does hysteria. You try to fearmonger. You try to do this stuff. And when they'll talk about hospitalizations, our hospitals are open for business. Like I said, Jackson, the COVID patients are half of what they were last year. Even in places that have more, COVID patients represent a fraction of the overall hospital beds. And so I don't want to see a repeat because of some of the media hysteria with people who have heart problems or stroke are not going in to get care. That happened in March of 2020 and in April. There was a huge decline in people who would show up to the ED. Literally, people are having heart attacks at home because they thought that there weren't either not enough room in the hospital or they thought that they would get COVID and die as a result of that. So we don't want to follow that. People should be good. You should go. And then I would say just the broader public, particularly our seniors who've been vaccinated, I think the data's clear. You may test positive. We hope that wouldn't happen, but the mortality and all that is dramatically reduced, and so you do have protection.